Global Health Strategies Initiative is affiliated to Global Health Strategies, which, as you all know, is an international organization advocating for improved access to health technologies and services to people who need them the most. The BRICS economies already account for over 25% of the gross global domestic product and could collectively surpass the group of 7 wealthy nations by 2032. And this, we know, is a fact that's being showcased by the growth of these economies. The Indian Prime Minister at the BRICS Sanya Summit in 2011 acknowledged this growing power of influence, and he said, really, the challenge before us is to harness the vast potential that exists amongst us. We are rich in resources, material and human capital. We are strengthened by the complementarities of our resource endowments. We share the vision of inclusive growth and prosperity in the world. We stand for a rule-based, stable, predictable global order. We respect each other's political systems and stages of development. We value diversity and plurality. Our priority is the rapid socio-economic transformation of our people and those of the developing world. Our cooperation is neither directed nor against or at the expense of anyone. This highlights really the underlying theme of our report, which showcases the commonalities, interests, and aspirations of the BRICS countries. And really, while the report focuses on health, but this really forms the basis overall of our report. We at GHSI believe that growth markets such as these can and do play a major role in global socioeconomic transformation, especially in the area of health and development landscape. And we believe that the findings of our report support this idea. We will be sharing our findings with you today, and David Gold, who's our principal and co-executive director of GHSI Summits, GHSI Strategies, who will be doing it. As the heads of BRICS countries gather here for a summit in New Delhi, we hope that this report and the conversations that we have today with our panel discussion stimulate the public and policy discussions. We are now going to hear from David Gold. After that, we have the honor of hearing from Mr. Shyam Saran, who will share a perspective. And really, he's someone who's played a central role in shaping India's foreign policy. We then have Pramit Pal Chaudhary, who's followed the BRICS growth and the BRICS summit, who will be moderating our discussion with distinguished panelists. Carlos Passarelli, who's here from Brazil, and as he describes himself, a global health activist. I mean, how can anyone from Brazil be anything different? We have Rani Malan, a distinguished academic, and Ashok Malik, who's a political commentator and one of those rare political commentators who are passionate about health. We finally then have Mr. Sachin Pilot, the Honorable Minister of State for Communications and Information Technology, who will release the report. And he will share some thoughts about India's role in health and development. I would like to inform you that this event is being webcast and will finally, the videotape be available at www.ghsiinitiatives.org. With that said, I'd like to introduce David Gold. Just a couple of words about David. David is the one who gets brilliant ideas all the time. And a lot of times when he shares his ideas, we become a little nervous. But this is one idea that did make us nervous because it was very ambitious. But today we stand here proud of the fact that we've all worked hard to produce it. I particularly want to thank Brad Titel, Katie, and Chandni Saxena for putting in so much effort into the report through evenings, through weekends. And once again, thank you so much, and David.
Thank you, Anjali. My background is an attorney by training, and I started out in global health by accident. I was in New York City when New York City was ground zero to the HIV epidemic. At one point, it had more than half the reported cases of AIDS in the world. And if you look at the history of AIDS, which I often do to try to figure out what we can learn from it, I think there are three major turning points. One was clearly the development of the new compounds, the ARVs, which was driven by science and a good deal of advocacy. Two was a step by the Brazilian government in 1996 that guaranteed HIV treatment for all Brazilians. And that was at a time when many of the policymakers and even the drug companies were saying the price of the ARVs is not what's stopping access to these drugs. It's the systems that are not in place, even in developing countries that are as advanced as Brazil. And Brazil showed that that doesn't have to be the case. And then three, in one of the incidents, which I think doesn't get enough credit, a guy named Youssef Hamid, the chairman of CIPLA, said in 2000, I can produce these drugs for $350 per patient per year in the developing world. At that time, they were charging about $4,000 for the very few people who would get these drugs in Africa and around the world. That changed the dynamic. He developed a small number of pills with these compounds. 2001, they started getting out, and it all of a sudden became much more affordable and a realistic thing. So if you look at back in seminal events in AIDS epidemic, 2 out of the 3 what I consider real turning points came from the BRICS countries. What we're seeing today is a different scale of investment and activity across many diseases, and I'll give a brief overview of that. Here's the report. We used a series of course, the GHS team, but investigators from 5 BRICS countries and a couple of other advisors, conscious of the fact that there's not that many good data on what development assistance we can generalize across countries and how much we can quantify that. Trend number 1, which Anjali mentioned, no surprise to all you, is that these countries are really developing economic powers. You saw in the financial crisis a downturn across the board, but nothing like what you saw in the G7. And then you see the rankings of GDP, 1990, 2012. You saw the difference. China number 2, Brazil 6, India 10. And then you see the estimates for 2030, which many people believe are conservative. These are based on Goldman Sachs 2007 numbers. And you see India moving to number 3. So the top 4 BRICS countries are all in the top 7. Whether Russia is in fact going to be ahead of Brazil it's certainly not clear. Finding number 2, and this might just be the most important finding that we found from our report, we tried to look at the rates of growth that these BRICS countries are, how they're investing in foreign assistance. And what we found that as in total, the 5 countries, their foreign assistance is growing at a rate of more than 10 times what the G7 are growing at if you look at between 2005 and 2010. Now, it's still in absolute terms. It doesn't compare in terms of actual total dollars or euros, rupees, however you calculate it. But the rates of growth are dramatically faster. And this doesn't count some of the very important donors like Spain, which is not a G7 country, but yet is a critically important country in global aid, and they have instituted massive cutbacks in global health assistance. So clearly the world is counting on the BRICS countries in terms of financial assistance and global health assistance in particular. Here's a visualization of what we do. You see the bars. The height represents the absolute terms of assistance between 2005 and 2010. The width is actually the rate of growth, and this is actually available on the web if anyone wants it, but we tried to visualize it in terms. Now we're going to just do a quick scan on what we found from the countries, basically themselves. Brazil, now 6th largest economy in the world. You can see our range of assistance was the most broad for Brazil, between 400 million and 1.2 billion. We think it's about $1 billion assistance if you could do it. They don't publicly disclose their rates of financial assistance on an annual basis. But if everything we looked at, we think it comes out around $1 billion. It's the biggest range we see. $350 million so far they've given to Haiti. They've taken the lead in the UN assistance program. And it's clear that health is a central component of Brazil's foreign assistance, and it's also enshrined in their constitution. HIV/AIDS, I mentioned their response to that. They've taken a lead in child nutrition. Multilateral financing, they've also made significant investments in WHO and PAHO, which is their regional health organization. And they've also co-founded an agency called UNITAID, which I believe Carlos might talk about later, which really focuses on access to health technologies. And they've given so far, according to our calculations, at least $37 million to UNITAID. And tobacco control. We thought this was really interesting. Brazil, in addition to an aggressive domestic program on tobacco control, they've also took the lead in a framework convention on tobacco control. And we think there's great opportunities for the BRICS countries to work together on that. Russia is the world's 11th largest economy, and among the BRICS countries, it's kind of unique in the sense that they've invested in multilateral assistance, the Global Fund, Gavi, the polio eradication, GPEI, much more than any of the other BRICS countries. And they've also tried to frame their assistance according to OECD standards and frameworks. And so that's the unique aspects of their country. And clearly health is a central component of their financial assistance programs. Polio and vaccine funding, they've given a significant amount of money. They were also the heart of some of the world's first oral polio vaccine trial showing efficacy. They made a big commitment to neglected tropical diseases. We were surprised that they've actually made some investment in malaria control in Africa. It's a lot of Russia's assistance is focused on the nearby countries in Central Asia. And recently they announced a big initiative on really trying to rejuvenate or grow their pharmaceutical industry. So they've committed about $4.4 billion to pharmaceuticals. We think that could have a big impact if it really comes to fruition, given their scientific capacity. India is clearly the fastest growing economy within the BRICS and one of the fastest growing in the world. We estimate the foreign assistance has grown from over 400 million to 680 million in 2010, and it's important that this does not count concessionary loan programs. Now, India has really committed billions of dollars to concessionary loan programs to its neighboring countries and also to Africa. China, on the other hand, uses some of the concessionary loans as foreign assistance. India does not label it that. Clearly, the biggest area that India is really impacting global health in the world is through its private sector pharmaceutical industry and vaccine industry. I think you could make a good case that the pharmaceutical and vaccine companies in India have done more to improve global health than the foreign assistance programs of most countries in the world. You look at hepatitis B, when the Indian companies started getting involved, the price went from $17 a dose of a 3-dose vaccine to $1 a dose over time. And you're seeing that similar reduction in price of vaccines across the board. It's really an extraordinary and exciting impact that's driving access to vaccines. Another area that we've highlighted is India's polio eradication program. The country has invested about $1.49 billion since 2003 on eradicating polio, and as many of you know, since it's been well more than a year since we've seen wild-type polio in India, an extraordinary accomplishment. And I believe when the history of polio eradication is written, this milestone will be one of the great milestones that has given hope to the world. Remember, you've seen outbreaks of vaccine-related polio in Russia and India and China over the last 2 years. So this was a huge boost to the effort, and we suggest in our key findings, which I'll go on later, that perhaps India could use this technical capacity, this mass mobilization, to create teams in polio endemic countries to provide assistance and use that model. And in e-health, you're seeing Indian expertise really starting to work its way into financial assistance programs and health assistance, and low-cost service delivery through its private network of hospitals and health clinics. Those sort of models that countries, all of the BRICS, are using in their own domestic health challenges, you're seeing really starting to roll out into other countries. And here's one of the slides that I find interesting. We highlight in the report, India produces about 60 to 80% of all vaccines that are pre-qualified by UN agencies, WHO basically, and are purchased by UN agencies, Gavi. And here you see the number of pre-qualified vaccines where India clearly surpasses all other countries. China is a fascinating area of research for us in this report. It's the second largest economy globally. Its GDP is larger than all other BRICS combined. They are rapidly growing their foreign assistance programs, particularly in Africa. We estimate that on an annual basis, it's about $3.9 billion. But remember, a good part of that is also in concessionary loans, which they do count as foreign assistance. The foreign assistance program has a limited focus on health. It's clearly more on infrastructure building. Nevertheless, there are some important areas where China is beginning to make a difference in global health. Since the beginning of their assistance programs in 1950, China has created medical teams that have gone out to multiple developing countries to really provide support in fighting disease and supporting health infrastructure. They've also made a growing investment in disease surveillance, partially out of SARS and other disease threats. So you're seeing assistance both to WHO and on a regional basis. Malaria control. China has pledged well over $100 million and invested that in malaria control in 2 meetings with its partners in Africa. And we did some discussions with a number of experts in China, and all of them told us that this program is real and it's having an impact. And we think this might be one of the areas where China can continue to drive, and if it scales up that investment, really give a huge boost to the global malaria control efforts. Family planning. China has the capacity, as we know from its own domestic program on family planning, to make a huge difference. It's beginning to develop that capacity. Contraceptive hormonal implants, they can develop them cheaply, and they're looking now towards more broadly outside of China to help make access to contraceptives more important. We think this is a significant area to watch. Their investment in R&D, like the other BRICS countries, particularly Brazil and India, is significant, and the Ministry of Science and Technology is now scaling up their investments, and we think this could be a big impact. They have a joint program with the Gates Foundation, a MOST partnership, where China is matching 2 to 1 the Gates Foundation's investment, and we think it could be significant. And in Global Fund, they doubled their contribution recently. So here you see the increase in China. South Africa is the smallest of the BRIC countries. I won't go into it in specifics about what it is. The thing to look about South Africa is 2 domestic things. One is their research on HIV. Their vaginal microbicide trial was significant. It showed for the first time efficacy in an ARV-based microbicide. And you're also seeing in TB diagnostics, South Africa made a big commitment to roll out state-of-the-art rapid TB diagnostic, a diagnostic node gene expert, and that'll be interesting. Beyond BRICS, you see the countries, it's in the report. Interesting stuff going on. Just to highlight, South Korea basically has gone the only country from a donor recipient to a OECD country. They're given about $1.2 billion, and about $136 million is health assistance. Key findings, they're all significant foreign assistance providers. But the increases have grown over the last 5 years. They're employing approaches that are based on their own domestic challenges. They're producing high-quality, low-cost vaccines or drugs that are making a huge difference, and they've declared health collaboration a priority. We've yet to see a true impact of that within the BRICS countries, but we hope to see that. Highlighting a few areas, access to vaccines, where they get TB control. All of these countries are high-burden countries. China hosted a ministerial meeting on drug-resistant TB in 2009. India has made a lot of progress. There's a huge opportunity. Brazil has pledged to do for TB what it did for HIV. Polio eradication, outbreaks in 3 countries over the last 2 years of the BRICS. Imagine if they got together and provided assistance to countries where they have a significant relation. China with countries like Pakistan, India with Afghanistan, and so forth. Non-communicable disease and tobacco control, disease surveillance, harmony of regulatory processes, and of course the BRICS Development Bank. I close with a quote from the Minister of Health, Ministries of Health, when they met in Beijing, pledged to collaborate. We think there's a historical opportunity for these countries to scale up their investment in global health using different models that reflect the interests of the population, the health and well-being of their citizens, building capacity in their own countries, increasing their own power, and finally, improving the lives and health of the poorest people in the world. So we thank you for your time, and we look forward to a lively discussion.
I think everyone can hear me, so may I request the Chancellor to inspect once again, so thank you very much.
Mr. David Gold, co-executive of the Global Health Strategies. Ms. Anjali Nair, co-executive director of Global Health Strategies India. Members of the discussion panel, distinguished guests, ladies and gentlemen. Let me at the outset thank the Global Health Strategies India for inviting me to this conference on the launch of the report on global health strategies for BRIC countries. And I very much look forward to the panel discussion which will take place subsequently. Let me just give you a sort of broad perspective about how India looks at the BRICS grouping. The fact is that over the last several years, there has been a steady diffusion of political and economic power throughout the world. There are many more important economic and political actors in the world today than in the past. Secondly, it is also true that over the last several years, the importance of what I call cross-cutting issues has also, the salience of those issues has increased, which means that issues such as public health or climate change or energy security, these have become issues which are not amenable to national or even regional solutions. And therefore, they need a kind of a collaborative response if we wish to be able to successfully tackle them. And the third point that I would like to make is that today we have the technology and we have the means to be able to share experiences across the globe far more effectively than ever before. So there is a communications revolution, there is social media, so a lot of very creative ideas today, they have the potential of being spread far more quickly than ever before. So that's really the kind of setting that we have. Why BRICS? This question is usually asked because these seem to be somewhat disparate group of countries, and sometimes people have difficulty in finding what really brings them together. What is it that they share in terms of their attributes? I think what they share is, number one, that at least 4 of them are emerging countries. Russia is a country which is in the process of revival, certainly looks at itself as a country in the process of revival. These are countries which may be developing in one sense, but they also are countries which have enormous resources, assets. To give you just an example, a country like India or China have very comprehensive training and human resource infrastructure, which can in fact contribute and has been contributing to capacity building in a lot of other developing countries. Another attribute which can be ascribed to them is that these are countries which in a sense are looking at a global order which has been in existence at least since the Second World War, and find that there are certain aspects of that global order which they are comfortable with, and they try to maybe make those elements in the global order work better. Second is that there are a number of elements in the global order which require modification, and which are the countries who are not only seeking to modify these global regimes, but have the political and economic clout to try and bring about that change. And these countries are, in fact, that category of countries. They are influential players today in the global field. And thirdly, also, as I said, there are a number of cross-cutting issues which are emerging. There are new kind of challenges which are emerging. Today we talk about, for example, cybersecurity, completely new area that had not been thought about before as a challenge. Or you have a area like space-based assets, which again require some kind of an international order. One could talk about several other issues which have been transformed from what they were before. For example, energy security. So these are kind of areas where there are new regimes or new architectures which are in the process of emerging. And I think what shape they will take is something which is very important to these emerging countries. In that sense, the coming together of these countries to try and mold these emerging architecture, this is something which is certainly a very important part of the cooperation that we are seeing emerge amongst the BRIC countries. So I'm not going into the political aspects, why there are certain issues on the international political scene which also may drive them to work together. But certainly in terms of these global cross-cutting issues, there is a great deal that they can do together. Now, this brings me to, of course, the kind of assistance or kind of support that these countries are able to provide to other developing countries. And I will take the example of India in this respect. The foreign assistance has been usually identified with the OECD countries. And the norms which govern the extension of that assistance is also according to norms which have been put forward by the OECD countries. But as has been pointed out, that now there are other important players in the field of what we would not call foreign assistance, but what we would call development cooperation. In fact, there is a certain allergy, certainly in India, to using the word assistance or aid. We would rather like to think about what we do together with other developing countries as, in fact, development cooperation. So the manner in which we look at assistance is not as a kind of a donor-recipient relationship, but rather a relationship which is in a two-way relationship, and that is why we call it development cooperation. So there is a certain, shall I say, almost an ideological difference in terms of how we look at our relationship with other developing countries. The other aspect that I would like to focus on from the Indian standpoint is that number one, India is not a new player in this field. In fact, Mr. Nehru inaugurated what was known as the Indian Technical and Economic Cooperation Program as far back as 1964. And the philosophy was what later became South-South cooperation, that even though we are developing countries, each one of us have areas of expertise, areas of capacity, which we can share with others. And I think that is the spirit which continues to drive how India looks at this whole aspect of development cooperation. Other aspect that I would like to focus on is that if you take the kind of experience that India is still, in fact, trying to develop for itself, just the Indian experience itself can be a very good reference point for very similar challenges which are being faced by other developing countries. And in this, I would like to focus attention on two aspects, both of which also have a public health dimension. I am talking about these because I am associated with these, so I know a little more about this than perhaps other areas. Take, for example, agriculture. Now, what we find in the agricultural sector is that the large-scale use of chemical fertilizers, large-scale use of pesticides, the contamination of water aquifers, all these have very major health consequences which are not taken into account when we are talking about agricultural costs of production. So typically you will find that in rural areas there is increased use of pesticides, but the kind of protective gear which normally farmers in other countries, more developed countries would use, in fact is not normally in use in the Indian countryside. So this leads to problems with skin diseases. It leads to problems with lung diseases. There are problems relating to eyesight. All these various consequences of a certain strategy of agricultural development which we have followed over the last several years, these health consequences have actually not been taken into account at all. And today we are beginning to focus on those consequences of this agricultural strategy, which today we are now trying to see whether or not the whole strategy of agricultural development can be shifted away from fertilizer intensive, water intensive, pesticide intensive strategies of growth into something which is going to be very different. And that would have very positive health consequences. So this is one aspect where a lot of the work that is currently being done in India could have actually could be a very useful point of reference for other countries. Another initiative that we have launched is called the National Clean Cook Stove Initiative. And this is of course, related to energy security as well, because a large part of the energy requirements of our rural population, and you'd be surprised, 22% of even the urban population is actually based on biomass burning. Again, this has very major health consequences. So in a large number of rural areas, because biomass is the chief source of cooking fuel, and you have certainly the lady of the household, and you have small children, sometimes newly born children who are in that enclosed space. Again, there is a huge health consequence, which is again not usually taken into account. And what we are trying to do through this initiative is to try and focus attention on that, providing affordable, clean cooking fuel to rural areas, and at the same time be mindful of the fact that there are these health consequences which we need to take care of. Now, if India is able to, say for example in the latter case, if India is able to achieve a measure of success, you can imagine what kind of impact it would have worldwide, because biomass continues to be the chief source of fuel in a very large number of developing countries. So this is one aspect that is the Indian experience itself, even if India does not provide assistance in this regard, but the Indian experience itself has major implications, very positive implications, one hopes, for the rest of the developing world. Lastly, I would also like to draw your attention to the fact that while the figures which are there for India's assistance to developing countries seem to be somewhat modest. The one thing that has to be appreciated is that whenever India provides a grant, it is pure grant. That is, 100% of that money actually goes for the program for which it is budgeted. What do I mean by that? I speak from my experience as ambassador in Nepal, where we have a very large number of small development projects, community development projects. Typically, the budget never exceeds 30 million rupees for each project, and each of these projects cannot be should be implemented within a period of 6 months to 1 year. Now, if we have, say, a drinking water project, the 30 million rupees that may be budgeted for that particular project is entirely used for that project. There is no administrative overload on that. There is no fees for any consultants. There is no fee at all for the administration of that particular project. Those costs are taken care of by the government itself. In our case, it was the economic wing in the Embassy of India in Kathmandu itself. So if we are saying 30 million rupees is going for this particular project, 100% is going for that particular project, which was not the case with even projects which were financed by, say, the international financial institutions. The other feature which is also very important is that in all our programs, we never try to bypass the local government. I think which is a very important feature sometimes of the OECD kind of assistance which is given. Usually working through, say, international NGOs or local NGOs, but not really working through the local government or the development division. In our case, we always had a three-way MOU between the Embassy of India and the local development officer, as well as the local community representative. And this ensured that we had the entire local government machinery also on board when we pursued these projects. So there is a certain difference in philosophy and a certain difference in the manner in which we administer some of these development cooperation programs. And I think these are the principles which you will find will be probably set out in the new development agency which is being set up under the Ministry of External Affairs. So I wish you all success in your deliberations today, and I look forward to the plenary discussion. Thank you very much for your attention.
I'd like to welcome you to a panel discussion on global health and the BRICS. We'll start off with Dr. Carlos Passarelli, who is, besides being a global health activist, is also senior advisor for treatment at UNAIDS. After that, we'll have Dr. Rani Mullen from the Center for Policy Research here, Delhi. And then I'll have Ashok Malik, a well-known columnist and commentator who also, I'll advertise, writes also for my newspaper. Both of them, all of them will take this topic in a slightly different perspective, but one of the things, three themes that I think we should all try to keep in mind as we go through this discussion is one, is there actually a genuine synergy in BRICS? I mean, this is an organization, as we all know, is put together by a Goldman Sachs report, but is there actually something coming through on this? Does it actually, can it actually work together? We've already, Mr. Gold has also mentioned the remarkable role, for example, of the private sector in India in terms of global vaccine production. And again, is there a public-private sector partnership within what these BRICS countries are doing that can be used to perhaps both allow ourselves to grow at home as well as provide a global public good, if you wish. And finally, and I think this is something that we also should keep in mind, is there sufficient domestic political support for the idea of becoming big providers of aid or assistance overseas? Because we're still developing countries, all of us. So this is something that we have to keep in mind, that as we become more globally engaged and the more we do for the rest of the world, will there be potentially a backlash within the system saying that why are we helping all these people when we seem to have a lot of problems still at home? Having said that, I'd like to begin with Dr. Passarelli, who will speak in particular about the role that, and the lessons that Brazil has learned and what they can teach us about global health.
Thank you, and good morning, everyone. Bom dia, as we say in Portuguese. First of all, I'd like to thank you very much, GSI team, and for inviting me for this interesting meeting. It's a meeting that has a political importance in terms of what's going to happen in the following days in Delhi, considering that we're going to have here the summit of the BRICS summit. And I think that the initiative of GSI is very important to push the health agenda in the BRICS agenda, because I think that there is a lot of political commitments made, as David said before, during the Beijing meeting, and now I think that it's part of our job to push this agenda in terms of to see what will be the concrete steps will be for implementing the declaration. I would like to start bringing what was already mentioned by the Ambassador Saran. And in this, he's mentioned the allergy of the countries to the expression assistance or aid. Indeed, I think that Brazil, South Africa, and India, they are working very much towards cooperation, collaboration, or South-to-South cooperation, which is not only a theoretical or philosophical discussion, but I think that implementing technical support or technical cooperation instead of technical assistance or international aid is more has practical implications, because we need to develop, we need to establish mechanisms to follow this kind of guiding principle. It's not empty words. We need practical steps in order to support other countries, sharing experiences and sharing our technical background, technical capacity that really exists at country level. And we need to implement the means to share those experiences, and in an accountable way, and establishing as well transfer of funds to other countries. And it's something that it's important to pursue. The other implication, and Ambassador Saran mentioned before, is the political implications. I mean, we are talking about, I don't remember the expression that he used it before, it's order, global order. And I would say we need to think about those countries' perspectives on global governance. Taking the Brazilian example on HIV/AIDS, in 1996, as David mentioned before, Brazil established this policy providing, which was supposed to provide universal access to HIV antiretroviral treatment for all patients in need in Brazil. And it was not that easy at that time, because we didn't have too much resources in terms of money, in terms of funds. We have some local capacity for production. It's not a huge capacity, but a local capacity. But this little capacity was very important to make the big difference, because it was because of the drugs produced in Brazil, we were able to enroll a lot of patients in our treatment programs, in our treatment policies. And we show to the rest of the world that a developing country can do it. Of course, that we need some cooperation from other countries, developed and developing ones, but we had the means to do it, and it's very important. And growing, moving ahead in this agenda, and together with developing countries, especially the BRICS ones, we have pushed for the intellectual property agenda and its relation with access to health. Within the global health, within the WHO, India, Brazil, and other countries pushed very hard for the global strategy on public health, intellectual property, and innovation. And it's not a document that is supposed to be forgotten somewhere in WHO, but we need to use the capacity of those countries to implement this agenda. And I think that the Beijing Declaration, when it establishes the technological network among the BRICS countries in order to support other countries to scale up access to health technologies, I think it's a concrete step that should be taken. It was not taken already, but that must be taken in order to transform principles, ideals in steps and access to health. Thank you.
Dr. Mullen.
Thank you. I should preface my comments by saying I'm an academic. I'm trained in the field of political science. I thought what I could do, since some of the points I wanted to make have already been covered by Ambassador Saran and also by Mr. Gold, that I will try and look at some overarching thoughts that I had on the BRICS countries, and then some specific comments on Indian foreign aid, which I have recently been researching. One should keep in mind that when we're talking about the BRICS and developing countries, most, as I believe Mr. Gold also said, most aid, over 80% of foreign aid globally still goes through, is given by OECD countries. But of course, the percentage of increase is much larger, has been increasing more rapidly amongst countries such as the BRIC countries. And there's also the commonality of experience amongst BRIC countries. With the end of Cold War, aid became less ideologically driven, more of a shared experience. It's interesting to see that almost all BRIC countries like to use the word partnership. Focus is on horizontal rather than hierarchical relationships. One should also point out that while maybe the rest of the world is waking up to the fact that BRIC countries are giving foreign aid, they are in fact not emerging. They have been, as Mr. Ambassador Saran mentioned, in India's case, shortly after independence, started giving aid to Bhutan, for example. So there's much history behind these so-called emerging donors. And as we see with globalization, in fact, what we now see happening is increased sharing of these experiences that they have had over the past decades. What I also find interesting is when you look at the BRIC countries, there is, and look at their aid coordination structure amongst the subset of BRIC countries known as the IPSA countries, there is in fact quite a bit of similarity. Brazil's ABC structure, India's newly announced Development Partnership Administration structure, which is housed in the Ministry of External Affairs, and South Africa's SADPA structure are in fact all housed within the country's respective Ministry of External Affairs. They're not independent agencies. They use, as mentioned by Ambassador Saran, use embassy staff to administer in their respective countries their aid portfolio, and the interface in the respective countries is in fact the embassy, so that foreign aid is in fact a tool of foreign policy. The focus, as I mentioned, is on partnerships, not aid, and overall there's a more statist approach. They're all characterized by no conditionalities and tend to be demand-driven by the country taking on a loan or a project. I also wanted to mention that when we look at aid amounts, we are in fact to some degree comparing apples and oranges, because China, for example, doesn't publish much of its aid amount at all. 90% of China's foreign aid is in the form of loans, whereas as we heard earlier, in India's Ministry of External Affairs published information, Exim Bank loans, which are administered through the Ministry of Finance, are not even included. And you might be aware, for example, that in 2010, India gave a $1 billion US dollar $1 billion loan to Bangladesh. And the concessional rate was at 1.75, which is below the rate given by multilateral agencies, for example. So in trying to understand, in fact, if you would take these concessional loans into account for India, which China takes into account in reporting its data, India would be probably second amongst BRIC countries in terms of its overall aid flow. Then there are also some differences amongst these BRIC countries. Russia is at one end of the spectrum, for example, with regard to transparency and reporting of aid. Russia reports all of its aid through DAC, while China is the other extreme of not sharing aid data. And of course, these labels of creditors and donors belie much more complex ties in the field of development assistance. In 2009, 2010, India, for example, became World Bank's largest borrower, while at the same time it's transitioning currently and is slated by 2014 to become a net creditor of aid. So labels are fluid. They're not only fluid for BRICS countries, they've historically been fluid for developed countries. Think about, for example, the example of South Korea, which graduated from being a borrower, but then in the Asian financial crisis of the late 1990s, had to then borrow. So there's some flux here also that should be kept in mind. India has much to offer in terms of technical assistance, the experience of being a developing country, but it also continues to need technical assistance in some specialized fields. And then the other thing to, of course, keep in mind is that all aid has a political dimension to it. You do have humanitarian aid. But of course, you have the geostrategic dimension, you have the issue of wanting to try and access natural resources, and there's much competition there between India and China in trying to access Central Asian resources, and then commercial interests. But the BRIC countries and IPSA have many advantages. The aid that they give is low cost, much less overhead. Theirs is a developing country experience. India, for example, can harness its cutting-edge IT technology to leverage, as is mentioned in the report, the Pan-African e-network, which now has gone to 49 countries recently, 48, 49, and in sub-Saharan Africa, linking super specialty hospitals in India with hospitals and centers in Africa. There's much R&D going on in India, and India is, as also mentioned in the vaccine manufacturers and what India has been able to do to open up the access to generic drugs, and through that been pushing down the cost of drugs worldwide. So there's much that these BRICS countries have to offer that might change, and hopefully will change, the cost of development aid worldwide, and in terms of sharing lessons that are perhaps in many cases more appropriate for other developing countries. Thank you.
Mr. Malik.
Thanks, Pramit. Like Rani, I have had a problem for the past 5 minutes hurriedly making notes, because a lot of what I wanted to say, Mr. Saran already said, and said much better. So, there are 4 points I want to make. While all of us are enthusiastic about the idea of BRICS, especially given the BRICS summit which is coming up, when it comes to international assistance and aid or partnership programs, the BRICS countries are still at an individual stage. We're still at a stage of a Russia program and an India program and a China program. Someday the sum of the parts will add up to something larger and into a BRICS ecosystem, but that's not going to happen anytime soon. So let's not be over-enthusiastic about that. Let's be cautious about that. All of these countries are, of course, stepping up their development assistance program. But again, this is not a wide spectrum approach. They're only going to do it in sectors or areas where they have excess capacities. All of them, especially India and China, are going to be mindful of potential or domestic opposition or protest in case domestic capacities are seen as being diverted overseas. So this hasn't happened in India, and I hope it doesn't. But it's only going. going to stay this way if our assistance program is limited to areas where we have excess capacities. Now, in the case of India, these are human capacity building, as Mr. Saran pointed out, knowledge sharing, our IT platforms, which can be used for diverse social and development needs, our drugs and vaccine manufacture, our pharmaceutical industry, which is doing a very good job, and in some technologies, such as space technology, where we have an expertise which is actually, we punch much beyond our weight. Now, in some of these areas, such as IT, knowledge sharing, and drugs and vaccines, as has been pointed out, our private sector is doing a very good job. They are the ones who are actually exploring new areas, new markets, new geographies. And the government is, in a sense, playing catch-up, which is fine. I mean, I'd much rather have that than the government doing the exploring with the private sector catching up. You need here really the government to play facilitator and the aid program to merge with existing commercial and business relationships, and to facilitate a process that already exists. So what are straightforward commercial transactions today and making sense to both sellers and recipients or buyers can be merged with the Government of India's sort of assistance or aid program, and what is now seen as a product or a vaccine delivered by an individual Indian manufacturer can perhaps someday go as the gift of the people of India to a certain country. Where will Indian or BRICS assistance programs really be useful? I think they'll only be useful in those areas where the solutions which BRICS countries provide are seen as making more sense to the developing countries as opposed to a solution which is provided by, say, a developed country. And also in areas where the Indian or BRICS solution is a low-cost solution and cheaper and easier to sort of use and implement. And here I'd like to give two examples, two very different examples. We have discussed the HIV ARTs, which were the antiretrovirals which were sent out from India and which were so much cheaper than anything the West produced. But there are other examples from other areas as well. Africa is going through a huge and very ambitious university building program at the moment. And even last month when you had the Delhi Book Fair, you had a lot of African universities coming here to buy books from India, law books, technical journals, which can be used in Africa, which makes sense in African libraries, and which are much cheaper in India than they would be in, say, Britain or America. And finally, look at Afghanistan. The West has had a very ambitious and very resource-heavy assistance program in Afghanistan since 9/11, since for the last 10 years. India has had a much smaller program. We've spent much less than the West has. But in many ways, because our solutions have made more sense to the population in Afghanistan, and because we've also sort of spent money more smartly, I'd say, I think we've again punched well above our weight and had a very good impact on the field there. And this is now being recognized by more developed countries such as the United States. So essentially, the BRICS countries can fill a gap between the developed world and the developing world much more easily than someone from the developed world coming in and offering a solution to developing countries. I'd like to end there.
I think we'll have time for one more round of questions here before I turn to the audience. Starting with Dr. Passarelli, what's striking is that all three of you speakers have mentioned that there are things that can be done between the BRICS countries, not only in terms of lessons, but the institutional structures and the information sharing is still, in effect, nascent, if not non-existent. First, does it make sense for us to be working first bilaterally and then moving on to something larger and looking beyond BRICS? I mean, we had a number of other emerging countries that are there which potentially have the capacity to join in. Or does it make, and then third, does it make sense for us to work with existing structures? Does it make sense to go to the WHO and then try to plug ourselves into there? So I mean, how do we institutionally try to do this sort of synergy that we all are saying exists as potentially there?
Thank you for the question. I think that there are a lot of or some ongoing experiences in terms of bilateral cooperation among those countries. And I think that the IBSA forum, India, Brazil, and South Africa forum, is a sort of experience in terms of trying to find the means to fund cooperation and to provide cooperation. There is the IBSA fund, which is around 1 million from each country per year in this fund, managed by the UNDP. And some activities are being undertaken under this forum, let's say this way. As I mentioned during my comments, my first comments, I think that technological network should be an interesting tool in order to go ahead with the agenda, because we had already we had in the past a technological cooperation network with the same objectives but focused on HIV/AIDS, and the present technological network has a broader agenda, which encompasses treatment for NCDs, non-communicable diseases. So it's not only HIV which is an agenda. So I think that we have a lot of bilateral, trilateral experiences that must be expanded and go to other countries as well.
Actually, I'll just ask one more set of questions, and I'll just ask you a simple one. We have unfortunately, we don't have anybody from China here today, and that actually is a reflection of one of the other problems within the BRICS, is a fellow couldn't get a visa in time, and reflects, I think, the continuing strains between India and China, which is the fact that at least 3 of the BRICS countries have political problems with each other: Russia versus China, India versus China. Brazil is fortunately outside of it, and none of us are good at football. How much could foreign policy or geopolitics come in the way of something like this in terms of aid cooperation?
Well, donor coordination is notoriously difficult. It's that's nothing new, even amongst OECD countries. But and bilateral aid, as I mentioned, has been going on for a while. India has been giving aid since the 1950s. Brazil also has been in the aid business for a while. So what's new is this trying to find forums where countries can share, in an increasingly globalized world, share these experiences. And I think the more those experiences can be shared to harness the commonality of experiences amongst developing countries, the better in the end for the countries that are receiving the aid on the other end. I think we should probably, I'll leave it at that.
We have a few more minutes to go before Mr. Pilot releases the report officially. Please, are there any questions in the audience? And I can see quite a few hands already up, starting with the gentleman in the front. Yeah, just wait for the microphone, please, and identify yourself.
Well, I'm Dr. Sethi. One aspect which has been mentioned in the report is about the economic growth in BRICS, and specifically so in India, I'm referring to. Certainly the economic growth is there. And if you look into the economic growth, it's like this. But if you look into the growth in the health sector, it is much more, much faster. Now, I'm not sure whether that aspect has been given in the report or not, but health sector growth is much faster than the economic growth within our country. That's one point. Picking up the cue from here, no doubt in the report has been mentioned low cost thing is there, and as per the discussion, aid, and the second aspect has been mentioned about cooperation and assisting. It's all mentioned. A point which I'd like to cut across is investing in health in such countries. Would it not be a good proposition? That's a question which I'm posing, because what I feel that in India, specifically in India, the economy of scale keeps the cost low. And in terms of efficiency, it's quite efficient. In terms of quality, it's reasonably good. To give an example, for MRI, the cost is about $70 to $80. In comparison to other countries, very high. So No doubt, if we invest in health, initially the yield may not be so fast, but later on, if we invest in health in such countries, the dividend is going to be good, and it's going to be a win-win situation for the world.
This lady in the back and this gentleman in the front after that. We'll just collect all the questions together much faster.
Okay, my name is Patrulekha Chatterjee. I'm an independent columnist and a commentator on health and development. My question is to Mr. Passarelli. A very interesting reference to possible cooperation or existing cooperation between the BRICS countries on health, access to affordable medicines, in which Brazil has a very inspiring example to the rest of us. My question is a very specific one. In India right now, we're at a very interesting stage where we are actually having this discussion revolving around intellectual property rights and public health. Now on that, Brazil has taken very important positions in the past. What is your position on the use of compulsory licensing? Is there a possibility between, cooperation between the BRICS countries on that, in the debate on affordable medicines and intellectual property rights?
Thank you. I'm Vinod Paul. I'm chair of the pediatrics department at AIIMS. Three brief points. One, within the BRICS system, as of now, for health, there is very little commonality that I am aware of. But one paradigm that can join us together is the emerging paradigm of universal health coverage. India is considering it seriously in a very significant way at the policy level. Brazil has done it, and the model seems to be very much amenable to scale up here on the face of it. China is grappling with it in a very different way, and South Africa also made some progress. So at least 4 of the 5 countries have one binding thread, evolving and lessons to learn from your country. So could bind. So a suggestion would be, can we come together on this platform as a beginning for the larger health agenda, and that could be taken up in the summit, and there could be a UHC BRICS summit maybe a year from now. 2 other aspects. I think we have talked about global goods in the health sector in one paradigm of products, pharmaceutical products, and so on. But there are 2 other kinds of products that we can offer. One is the products that can emanate from the centers of excellence within the institution in a very modest way to begin with. And what are these? What are the possibilities? The possibilities are that our centers of excellence, let's say as AIIMS or DBT institutions or ICMR institutions and others, can offer specialty training, training in advanced laboratory techniques, for example, research methodology, and so on and so forth. I was in Nepal just 2 days ago, and there's a very potent request from them to train in super specialties. I'm sure it is possible for us to train 50 from Nepal over 5 years in this country, and without compromising our own training agenda, and so on. You talked about the e-health network in 48 countries. My department runs newborn training in 8 countries through our own resources. What we don't have in centers of excellence is we need resources. We need extra hands for us to be able to perform this job, which never comes. So we hear the intent at times at the political level, but this does not get translated into the capacity which must happen, technological and human resources, for us to deliver this kind of an extra agenda. But I think India's leadership would demand that we build these pieces, and we can be in a very unique position to contribute to the global health development beyond the BRICS. And the last one is, likewise, we have program tools that are available to us. India has excelled in developing tools for primary care, for health workers, for health management. These can be shared. People are looking forward for us to offer this to Nepal, to Bangladesh, to Indonesia, and Africa. And we could be the promoter of these global goods which emanate from the program, largely the government program. Thank you.
Last question in the back.
Myself, Dhananjay from Nai Dunya, health editor myself. You talked about drugs and vaccines and cheap ones. I know China wares, health wares are very cheap, but there is a credibility deficit. we come to know from our doctors that don't depend on the vaccines and drugs that China produce. They are in a hurry to push their drugs and vaccines without clinical trials. That is the question.
So I'll go in the same order and ask each of you. Dr. Passerelli, you actually had a question directly aimed at yourself, so please.
Thank you for the questions. I think that I'm the only one health specialist in this session, so I have a huge responsibility here. You can help me. Well, sorry for I'm very difficult with keeping your names. So the third question that comes from here and the first one, I would like to answer for them jointly. I think that you are right. I think universal coverage is a very important platform that BRICS countries should or must encompass, since we have a lot of experiences in Brazil and in India and other BRICS countries, I would say South Africa, in terms of reaching universal coverage for citizens in a different model that, or traditional model, let's say this way, as we see in Europe or developed countries. The United States is facing a huge discussion on their reform of their health system. I think that Brazil and India can support you on this if you want. But I think the initial, it's a big discussion. Last year there is a huge conference of universal access hosted by the German government. And indeed, the WHO has launched a report on this issue, and there is no solutions for that, easy solutions for that. And in this matter, we can share our experiences with other countries in terms of how can offer social security, social welfare from our citizens. And we do have experiences that really work. The issue of, and in this regard you are right, you have to invest in health. And I think that all BRICS countries, they are improving their investment in health, but it's, we need to invest more, much more. And we have the conditions to do that. It depends on political will. Brazil has just passed a bill to establish a minimal threshold for investment in health by the public sector. And there is also the issue of, which is particular interesting in India, the issue between the participation of the private sector and all the generic companies. As far as I know, they are private companies, and how they are going to interact with public policies in health or to support public policies in health in order to offer access to all. The issue of the compulsory license in Brazil, we had issued the compulsory license of antiretroviral drug only once in 2007. At that time, I was working to the Ministry of Health in Brazil, and I was one of the responsibles for the process. So my answer is yes, I'm very favorable for compulsory licenses. I think that we need to discuss, especially with the India government, considering the issue of local production is under the private sector. We need to discuss this further in order to promote access for drugs, especially for middle-income countries. We have a lot of global initiatives that are covering the most in need, let's say this way, the African countries, talking about HIV/AIDS. But we have a lot of emerging diseases, let's say this way, that are affecting very strongly developing countries as well, emerging countries, emerging economies. And I think that the use of TRIPS flexibilities and especially compulsory licensing, would be a manner to make access for those drugs made easy for those countries. I think I'm going to stop for now.
Okay. Dr. Mullen, you wanted to make some statements. Yeah.
Well, I'm not a health expert, but I would like to maybe just go back to your initial sort of overarching theme of is there BRICS synergy, public-private partnership, and domestic support for foreign aid. And there I just wanted to say that there's much that the BRICS countries can share that's already happening in terms of public-private partnership. In India, for example, at the subnational level, many Indian states are exploring quite innovative mechanisms that has much to offer other developing countries. And one could take, for example, the Pan-African E-network, which is admirable, and now the links are with 48 sub-Saharan African countries. And yet, that kind of thing could be expanded within India a lot, and there's much to be learned in terms of, as one expands this, what is India bringing to the table in terms of IT, in terms of trying to keep the costs down, how can the governments offer a more supporting platform for exploring private-public partnerships. So there's much to be learned and shared amongst these countries. Thanks.
I'll leave Ashok with the last comment.
There's something Rani said about learning from other BRICS countries, and I just remember the story from the 2009 Indian general election. The Telugu Desam is a party in Andhra Pradesh, and they produced a manifesto for that election which spoke about cash transfers. And they said that cash transfers will be contingent upon the family meeting some goals, sending children to school, meeting immunization goals, so there'd be a broader social development as well as health, as well as poverty, anti-poverty sort of element to that cash transfer. And I was very impressed by the manifesto, and I said, this is very, very good. So I called up somebody in Hyderabad and started to interview the person who had written the manifesto and said, where did you get these ideas from? And he said, actually we stole them all from the Brazilians. The Brazilians run a very successful program called Bolsa Familia. And if you look at that, this is exactly what we picked up from that. We thought it was very useful, and it can be used in our country as well. So there are things we're learning from each other, sometimes without acknowledging them.
So I'll just say, as we conclude, I'll just say that perhaps as looking at it in a foreign policy perspective and listening to what we've all said, the next time we have this, it'll be the shifting paradigm, maybe how reshaping global health and how global health and development are reshaping the BRICS potentially rather than the other way around.
Thank you very much, Pramit. That was really a very good discussion. I'm sorry we're running a few minutes late, but now I am going to request Mr. Saran to hand the report over to Mr. Pilot, and then a brief remarks by Mr. Pilot. And please don't leave. My colleagues are going to give you some flowers and say thank you formally. Mr. Pilot and Mr. Saran, please, some flowers from my team. And may I request the others to give some flowers to the panelists, please? Mr. Pilot, some brief remarks from you. It's a moment we've been waiting for. There will be time for others to have some questions for the panelists as well as for the media persons who are here.
Thank you very much. Let me start by thanking Global Health Strategies India team for inviting me here today. And before I read out what's been prepared here after the report was read, I want to make a small comment about what Ashok Malik pointed out about political parties making issues such as health a priority and kind of linking it to incentivization of getting cash transfers and money, etc. I think what needs to be done is that we must work to make these issues a priority on the political agenda. It's a great social agenda. It's almost a good economic agenda. But unless these issues become, at least in this part of the world, in India, a political agenda, it will not get the traction it needs and it deserves. So irrespective of political parties, the fact of the matter is that in 2009, Telugu Desam got 2 out of 40 MPs in Andhra Pradesh. And I'm saying this not because I belong to another political party, but the point is that people in this country, in rural India, in urban India, must realize that this is what we want our policymakers to advocate, to deliver, and those tangible results must really be reflected in the goodwill that political leaders can collect from the voters at large. That sort of rethinking has begun to happen, but I suspect has not reached a critical mass, which will then push us to working on this far more diligently than we do as lawmakers and as government. The report that was released just now, given the change that BRICS countries are bringing about, the discussion has centered primarily around the economic progress of these countries and as markets. But this report, I think, sheds light on an interesting area, that of global health and development. The report will be a valuable resource for all of us in the days to come. The world, as you know, is in transition. 20 years ago, we put the predictability of the bipolar system behind us, and today the lone superpower, the US, is in economic retreat. The world is looking to new anchors and reference points. No one country can do this job alone, at least not in the foreseeable future. And as such, entities such as G20 comprise the building blocks of a new world and of a new 21st century international system. Few organizations play as critical a role as the one that has been drawn in this room, the BRICS, the acronym for Brazil, Russia, India, China, and South Africa. Later this week, the leaders of the BRICS countries will gather in New Delhi for their now regular summit. The idea of BRICS emerged from a Goldman Sachs report that listed the 4 strongest emerging economies in the world. These were the 4 developing countries with trillion-dollar GDPs. South Africa was added to the list as a heavyweight economy of the African continent. A continent, to my mind, that represents the next frontier of human prosperity and economic opportunity. Today, BRICS is much more than a collective group of strong economies. Its members have taken similar positions on issues such as climate change, sustainability, and reform of international institutions. The BRICS represents a non-Western, but not necessarily, and I repeat, not necessarily an anti-Western template of modernity. Together, they offer a model of how it is possible to lift hundreds of millions of people out of poverty in a very short period of time. Each of the BRICS countries is a rising influence in its own unique way and wants to be acknowledged as such. Paradoxically, each of the BRICS members is also a developing country with many of its own internal challenges. The irony is best captured in the fact that was discussed in the panel discussion that BRICS countries are both donors as well as recipients of international aid. This report, Shifting Paradigm, how BRICS are reshaping global health and development, prepared with acute analysis by the GHSI team, tells us the solutions and ideas offered by BRICS countries that are already gaining traction and ground can be borrowed by other nations in the time to come. And why? There are 2 reasons for this. First, the economic slowdown is reducing the influence of the US and Europe. The BRICS countries and other emerging economies are beginning to fill some of these gaps, especially in areas and sectors where they sense a strategic need to do so. India and its region is the largest economy, is perhaps the most vibrant economy. The same is the case with South Africa and Brazil in the different continents. The developing countries can often empathize more with the BRICS nations, much more than they can or they have traditionally with the developed countries. India has always maintained a position as a responsible member of the international community. It has always been our endeavor to argue for the cause of the developing countries when it comes to discussions at a global or a multilateral platform. We're also leveraging our experiences of the last few years to develop the capacity of other developing nations in sectors such as IT, telecom, e-governance, health, education, and economic reforms. A few examples of the innovations in the health sector which India has contributed to. The Indian drug manufacturers, for example, have played a critical role in driving down prices and improving access to vaccines and HIV/AIDS treatment for millions of people across the world. The role Indian generic pharma makers have played in control of AIDS epidemic by drastically reducing the price points of antiretroviral drugs is also very well known. And as this report reminds us, the story did not end there. Indian vaccine manufacturers have helped make the recently developed MenAfriVac meningitis A vaccine available specifically in Africa. India's IT prowess that was mentioned by Dr. Mullen has allowed us to build an impressive e-health platform, including the Pan-Africa Telemedicine and Teleeducation Network, which we now have been told have 48 member countries. We had planned this for all the African Union members, but the South Africans very politely declined and said we don't need that network. This has linked many countries to centers of excellence in India. There is regular teleconferencing, there's regular exchange of ideas, debates and discussions, both technical and non-technical, from universities, research centers, scientists, even politicians. And I've seen some of these setups in some parts of Africa and where they have their counterparts in India. I think it's a great opportunity for people to have the access to knowledge and information, solutions, lessons learned. This is all happening real time, and especially for young people. I see the enthusiasm when I see them across the screen, and there's a lot of travel from people, lecturers, professors from this part of the world in India into the various African countries. Other BRICS countries are also making important contributions. Brazil's Bolsa Familia conditional cash transfer program has inspired similar projects in 50 countries. By linking cash transfers to immunization, the program has also prevented debilitating childhood diseases. Russia is leading polio eradication efforts in its region and has generously donated to the Global Polio Eradication Initiative. Russia has also committed extensive resources to control of the neglected tropical diseases, a crying concern in South America, Africa, and Asia, but not a priority specifically for the Western pharma companies. China is a leader in producing low-cost family planning technologies. South Africa's public-private institute, BioVac Institute, supplies vaccines to Namibia, Botswana, and Swaziland. Details of many such more examples are there for all of us to see, and many more can be found in this very readable and thought-provoking report, which I must thank GHSI team for putting together. Friends, I would urge you to read the report. This is a much-needed quantitative assessment and offers us an opportunity to reflect on the route ahead for BRICS countries, individually and together. In this discussion, which I was very happy to hear, it's not just about AIDS and initiatives in the health sector, but the geopolitics of today's age in the 21st century demands for all of us to work together. We're all very different, unique countries in the BRICS, but there's something that gets us together. We have different status of society, we have our own unique challenges and problems, but we still have the collective desire amongst our people and in governments that we have to work to create a new global order. A global order which is far more representative than the global order post-Second World War. And this is a fact, this is a reality, and things have begun to move in that direction. But I think the closer the cooperation, more will be the results, not just for our governments, but also for our people. The BRICS countries are interestingly poised in that they inhabit several centuries, as it were. Sections of our population live in grinding poverty and encounter malnutrition. Malnutrition is a huge concern in this country, and I've personally been monitoring some of the developments that have happened in the last few years. I take no pride in saying this, but 45% of our children below the age of 5 in India are either undernourished or malnourished. And there is no reason for an economy which is growing at 7-8% a year to have this kind of chronic problem. And we've not been able to make much efforts and much success as we perhaps should have. And the Prime Minister himself has indicated that this is a problem that needs to be tackled on a war footing in India. And I suspect similar is the condition, at least in some pockets of the other BRICS countries. there are also some sections of our population that live first world lives, white collar lives, and combat obesity and other lifestyle related health issues. So this is a contradiction in itself. This is the one that we have to learn to live with. In the end, India and other BRICS countries do not need to reinvent the whole wheel or ape the West blindly. We have shown that we have the intellectual capacity, the capital, and the resources to march ahead. Many of us are leveraging technology in a unique way and do not suffer from the legacy of old infrastructure. We can learn from the experiences of the economically richer nations, but must adapt to our own unique circumstances. The BRICS must adopt a cutting-edge sense of innovation and entrepreneurship to meet social sector and health challenges for themselves, for each other, and for the rest of the developing world. And as this report tells us, this captivating journey has already begun. It has the potential to transform the rest of our century. Thank you.
Wonderful learning experience, and most importantly, I really, really have to thank my colleagues, David for pushing us to do this report, and my colleagues for really working hard right up to this very moment. So thank you very much. Please join us for lunch. I do know that the media does want to speak to some of you, and they have some questions, so I request you to please stay behind. Thank you very much.